DNR and CPR. To talk about DNR, we need to talk about CPR. DNR means do not resuscitate, and CPR means cardiac pulmonary resuscitation. In CPR, the treatment is usually reserved for a body that has no beating heart, for a body that's gone through cardiac or respiratory arrest. Cardiac and respiratory arrest simply mean that the heart has stopped functioning and the lungs have also stopped functioning. They can't breathe anymore. So in CPR, a person drops with cardiac respiratory arrest, and a bystander recognizes that and begins chest compressions. When this happens in the hospital, usually your healthcare providers will jump in as it's rapidly identified, and the breaths are delivered with a bag mask apparatus, which is later converted to a life support machine. The idea of the rapid chest compressions is to try to jumpstart the heart back into a normal rhythm. Now, in the hospital, the ventilator is automatically used as quickly as possible. It consists of a breathing tube which sits in the airway that leads to your lungs, and the machine can have many settings, and it can provide anywhere from assisted breathing to full-on breathing. Now, is CPR safe? So in CPR, the chest compressions have to be 2 inches deep to be effective, and they have to be rapid. So ribs can break. Also, paddles are used to try to shock the heart if a rhythm is seen that can be shocked. Now, it's important to remember that CPR is designed for the heart, so it may get your heart pumping, but the same can't be said necessarily with your other organs. With just a few minutes of loss, there's a good, decent chance that your liver and kidney function will resume, but for example, the brain being very vulnerable and very critical, it can lose a lot of function. Every minute your body is in cardiac arrest, your organs, including your brain, lose critical function. And that loss of function can be catastrophic to your body. It's easy to take for granted all the number of functions that our brain is responsible for. In addition to speech, motor, sensations, and emotions, the brain is responsible for maintaining the secretion and supply of hormones, of metabolism, and of basic functions like breathing. And in situations where you have permanent brain tissue damage from the lack of oxygen, such as being in cardiac arrest for a long time, can lead to your brain no longer being able to direct your lungs to breathe. In those situations of permanent brain damage, it's not you that's really breathing, it's the machine. Now, this is important to discuss as CPR is really not a great treatment option for many people. The younger and healthier you are, the greater your chances of success from CPR. And also, if CPR is done in the hospital, you have a greater chance of survival than if it were done outside the hospital. Have a discussion with your family, your partner, significant others, to try to discuss which option is best for you and consider your goals of care. Have a frank discussion with your primary care physician, who is often best suited to navigate these discussions and give you the advice on what your chances of survival are. I think one of the best things you can do for yourself and your loved ones is to start having these discussions with them about your goals of care and your wishes. Often, by the time the patient ends up in a terminal state, family members don't know what the patient wanted, and then they're left having to make those choices. Okay, so I hope this has been educational for you, and we'll meet until next time.